It affects 0.5 to 1% of the population.
In the United States, about 2.5 million people have it.
It is the third most common neurological disorder next to stroke and Alzheimer's.
It is a neurological disorder that involves electric signals in the brain to travel incorrectly.
When this occurs, the brain reacts by having a seizure.
Those that are more likely to get epilepsy are before the age of 15 and after the age of 65. There are many factors that can trigger seizures. These include lack of sleep, stress, strokes, hormonal changes of the menstrual cycle, flickering lights, heat, and/or humidity. The causes of seizures vary from head injuries, strokes, brain infections such as meningitis, abnormal prenatal brain development, severe infections in any part of the body, diabetes, alcohol or drug withdrawal, and heat stroke. When someone is having an episode, the best thing to do is to make sure that the person does not hurt him or herself when they fall. While the episode is taking place, watch the person and record the length of time that the seizure took place and report it to their caretaker. If the length of time exceeds the time frame that is advised, you must call 911.
Hi, my name is Janae Fonseca, and I'm the parent of Kinsley Higgins. Kinsley, you want to say hi?
Hi.
And my name is Kinsley.
Kinsley.
She was completely normal child all the way to about 5 and a half, and that's when all of a sudden she would be just sitting on the floor and she would just stare off for a few seconds, or she'd be walking down the hallway and kind of lose her balance a little bit. So then we knew something was wrong, and so we took her to the doctors, and the doctor just gave her this test of hyperventilation, and she immediately had a staring seizure. And then he referred us to the neurologist at Stanford, and I was still very confused. I didn't know what was going on. And so the neurologist at Stanford gave her the same hyperventilation test, and she went into a staring spell seizure. And that's when he diagnosed her as having epilepsy, as petit mal epilepsy, which is the same thing as absence seizures.
Well, I've seen all the photos of me and Kinsley when we were really little playing and laughing together. So I'm in shock that she's completely out of it. She's always very sad looking. When we were really little, I used to copy whatever she did because she's my bigger sister, and we have this photo where Kinsley's going like this, and except she's looking at me to make sure I'm doing the same thing because I am doing the same thing.
Most recently, the last year, her medications aren't controlling the seizures. So it's very frustrating because she could fall and hit something on her head, and so someone has to be with her constantly. And now also with her epilepsy, she has progressive myoclonic petit mal epilepsy, which means the progressive is similar to having Alzheimer's. She has regressed tremendously in the last year, so she's forgotten how to bathe, how to eat, how to dress herself. So now I have to be the caregiver and do all that for her. She's regressed tremendously, and they don't know how much more she'll regress. They're completely unaware. They don't know. They don't have a case like Kinsley at all anywhere in the whole world as to follow as how she will progress. She's so courageous. She really dislikes going to doctors and having shots, but when I'm in a fearful moment, I think about her and how strong she is. So it makes me be able to go through that situation easier. It's great when people come to us, come to our aid when Kinsley has a seizure in public. It's so awesome. It's just amazing to see that empathy that people have and their wonderful open hearts.
We went to Disney World last week, and that was really nice because she had these seizures, and everyone just came running up and asking if we could do anything to help.
Kinsley was very outgoing and so friendly and loving and caring, and I'm choking up because within the last year her personality has changed so much. That has somewhat completely disappeared, and she's now just withdrawn from the world practically, and it's just really sad to see.